Hello and welcome everyone to tonight's digital health webinar brought to you by Health Network and Healthdirect. Before we get started, I would like to acknowledge the traditional custodians of the land we're meeting on. I acknowledge and respect their enduring culture and the contribution they make to the life of this city and this region. And I pay my respects to their elders past, present, and emerging. I also acknowledge and welcome any Aboriginal and Torres Strait Islander people who may be joining tonight's event. Their land was and has never been ceded. Tonight's webinar focuses on video telehealth and the use of Healthdirect's video call platform. My name's Michaela DeLeva. I'm a physiotherapist and Quality Improvement Project Officer at Health Network. And also with me tonight is Jodi Earle, Customer Support and Reporting Analyst at Healthdirect, and of course, finally, Kanal Mahiti, the events lead here at Capital Health Network. I'm just going to run through a little bit of housekeeping before we get started. So everybody has been muted this evening, so please address any questions in the Q&A section, not in your chat box, which is on the side panel of your Zoom window. We'll have a question and answer session after Jodi has finished presenting, but feel free to pop your questions in at any time. And if they're relevant, Jodi, I'm happy for you to jump in and address them.
Sure.
Finally, the presentation itself will be uploaded to the Capital Health Network YouTube page, and you're welcome to share this amongst your networks. In regards to CPD, please fill in our post-event evaluation survey and CHN will email you a certificate of attendance for the event. Please feel free to self-report 1 to 1.5 hours of educational activities to your CPD home for tonight's event. And just before we jump into things this evening, I would like to highlight the Health Pathways website, which has guidelines and advice on treatment and investigations of many conditions, but also up-to-date information on digital health topics, including electronic prescribing, My Health Record, secure messaging, and of course, telehealth. If you would like to access the Health Pathways page, the login is together and the password is for health, all one word. Health Pathways are a reliable source of up-to-date clinical and referral information that's localised to the Canberra area. Your feedback is invaluable to keep these pathways updated and reflective of our local health environment. You'll find a feedback tab at the bottom of each pathway, and we encourage everyone to use them. So before we jump into the presentation, I'm very pleased to welcome our speaker tonight, Jodi Earle, Customer Support for the Healthdirect Video Call team. Video Call is a safe, secure and flexible telehealth platform funded by Commonwealth and State Health. Jodi assists with onboarding and ongoing support for Video Call account holders, and she works closely with PHN's State Health telehealth teams and end users to ensure a stress-free telehealth experience for health service providers and for their patients. So please join me in welcoming Jodi tonight.
Thanks, Michaela, and welcome everyone. Thank you for joining on an evening. So I don't think we'll go for quite the hour, but we'll see how we go. So I'm just going to share a quick presentation and we'll run through that. Okay, so what I'll go over a little bit tonight is, why telehealth, then the benefits of video over phone. I'll give an overview of our platform and do a little bit of a demo, and then I'll talk to you about how you can get it and what you get from us if you have a video call account. So I'm sure that you're all very used to telehealth of some modality, but the reasons why we would use telehealth, and particularly now that we're not in the middle of the pandemic, is the convenience that it gives you and your patients to have consultations. So you can be anywhere in Australia, you can be overseas. That's you, your patients and clients. Telehealth provides increased access to health services for rural and less mobile patients. And there is a real time and cost saving as well in telehealth. So we have a little calculator on our site that if you even just pop in, a clinician doing 10 telehealth consultations a month, that's a saving of $30,000 for your patients. It's good for the environment. Time, money, and environmental savings certainly there. Having a look at telehealth, definitely it's something that's still being used extensively in Australia. But you can see that the majority of telehealth that's being done is still being done by phone, 87% to be exact. So this is from the Centre of Online Health, the 2023 telehealth activity. Even back in the middle of lockdowns, video was sitting at around 5 to 6%. So there's definitely a growth in video. But phone is still, the biggest modality that's being used for telehealth. So why we would say video is superior to phone, you do get a greater level of engagement with your patients or clients. It's really suitable for longer consults where you really need to keep the engagement. So healthcare plans and things like that. Video allows really easy and comfortable access to chronic care patients. So long and regular appointments that they don't need to be visiting your office to do. Video then also allows aspects of physical examination and it gives visual cues. So we have a lot of feedback from mental health clinicians in particular that their clients can be really comfortable that they're in their own environment, but the therapist can see what's going on around the client. With video, you can easily add additional participants. So that could be specialists, family members, interpreters, and everyone can be in different locations. So if you have a multi-party call or your patient or client needs some social support, you don't have to organize for everybody to come and meet in one spot. As with most video platforms, and certainly with ours, the patient and the clinician can share resources during a video call, which couldn't be done as easily on phone. And I will show you some of the options for that when we do a demo. And I think finally, telehealth, the MBS items are really leaning towards encouraging video for telehealth. So there are all the reasons, that it is worthwhile considering video as an option over telephone. So Healthdirect Video Call is one of the arms of Healthdirect. And it was a video platform that was initially developed for the Healthdirect helplines, pregnancy, birth and baby, the nurse triage line. And also we work really closely with State Health and we've developed a platform based on the feedback of what they would really like, in a perfect telehealth world. So it has been purpose built for health consultations. You can use Teams or Zoom or WhatsApp or any of the other ones, but this is really a platform that's built with the privacy needed, the security and the workflows for a health environment. So the Commonwealth funds 2 programs for supplying video call. One is the COVID-19 GP program, which has been running for about 4 years now, and 38% of Australian GP practices have a video call account currently. The other program is the PHN Exemplar, and it's been running for over 10 years, and that encompasses allied health, so all the therapies, nursing, child and family health, mental health. Then we've got some NGOs that the Commonwealth also funds, the ACCHOs, and more recently, residential aged care homes can also have a funded video call account. So that's just an overview of the program. And you can see there's still, some pretty healthy usage of video call, even for people that initially started using it because of COVID. So quick snapshot, Healthdirect Video Call works as a virtual waiting area dashboard. So it really mirrors what you would be doing in your clinic in real life. There's no special equipment or software or anything like that required. It's a web-based program. So as long as you have a browser, you can use it on your phone, an iPad, a laptop, a desktop, anywhere that you've got internet access, you can use it. And your patients and clients don't need an account. They just click on a link that you send them. And as I mentioned, we've got privacy and security built in throughout the platform. All the connections are fully encrypted, and we don't store any patient or personal health information on our platform. And again, government funded, so it's free to use for eligible health services and their patients. It's a simple and flexible program. So it works, as I said, on virtual waiting areas, and you can just fit it in with what your normal workflow for patient or client appointments would be. So you can use existing devices. You certainly don't need to buy anything new or have a fancy tech setup for it. We can also work with you if you're in an area that does struggle a little bit with bandwidth and connectivity. It's really customizable to make sure that it's maximizing, what you currently have access to. There's no apps needed or accounts or anything like that for the patients. And all of it can be configurable. If you get a video call account, it's ready to go within minutes, but there's a lot of configuration options if that's something that you would like. We can facilitate multi-party calls, as I mentioned, and we also have an option that you can do group calls of up to 20 participants in a video call. Okay, so I'm just going to stop sharing this one. I'll quickly share a screen, and just so everyone knows, I'm going to be my own patient tonight. So I'll show you that when it gets to it, but just bear with me for 1 sec. Okay, you should all be able to see now. This is basically a video call waiting area. So every clinic or health service that we have on the platform gets their own secure little waiting area that looks like this. So this is where everybody would come in to your waiting area. And all you need to do when you book the appointment is send them the link. You make sure that your patient or client has the link to come into your waiting area. You can copy it and paste it into something that you might already be sending. You can paste the link into the booking templates that you might already have on your booking platforms, or you can SMS or email directly from the platform. It comes with a little standard message here, which can be overtyped if you wanted to put some appointment information in, or you can also set some templates specific for your clinic if you wanted that to be a little bit personalized there. So when you book the appointment, you make sure that one way or another that your client gets the link and has the information about when their appointment time will be. And all they need to do is click on the link at the time, pop in some information that you get to decide what do you need to see to get them into your waiting area, and then they'll pop up there, which I will show you in just a sec. In the waiting area, there's also perform a pre-call test option, which you would only need to do one time just to make sure that your device is going to be accessing the right microphones, the right cameras, the right speakers. That will also identify for you any issues that you might have with the device that you're using, and you can certainly get in touch with our team, and we can resolve all of that so that you're just using video call when you need to. You'll see down the side here, when you first log into your video call account, you'll come into a dashboard. Initially, that's where we put information about new releases of features that we might have, or features that we think are going to be particularly relevant for people. So all of that information will be there. If you have, it changes every fortnight, so it will really keep you up to date with anything that we're building or things that are coming soon. We do work really closely with our funding jurisdictions and the health services with feature suggestions and feedback for what our users would really like to see. So in your clinic, depending on what kind of health service you are, you could be a private practitioner that you just have a clinic for yourself. You might be a big general practice and you can have all your doctors, all your admin staff, reception, everybody as team members in your clinic, and everybody would have access to your clinic to see clients, to see patients, to send the links, to manage your video call. And waiting area is really where it all happens. There's also meeting rooms in video call if you choose to have them, where you can do internal meetings, case conferences, stuff like that. There is also, as I mentioned, an option that you can create group meetings, group meeting rooms if you have regular or even ad hoc group rooms. The information down the bottom here, each clinic would have a clinic administrator who would have access to some of the higher level of the clinic. So you would decide who your administrator is going to be. They can add and manage team members. They can run reports so that you can see how often you're using telehealth, who's using it. And there are a number of configuration options. We will set up the clinic for you to, 95% of people use it in this general configuration, but we can certainly work with you if you wanted to personalize your clinic or, add a few little different features in there. So we'll go back to the waiting area and I'll join in as a patient. Apologies tonight, I'm going to be the doctor and the patient. So I've sent myself a text and I'm just filling in the information that the doctor's asked for. Okay, then you'll see me pop up in the waiting area here. So all your patients, regardless of how many service providers are in your clinic, will pop into the waiting area here. And just like as if they were sitting in your physical waiting area in your clinic, each of the service providers would just pop in and pick up the patient that's there to see them. Now, that will open in a purely secure new window. And you can see here, we've got waiting here. Once you pick someone up, to anyone else that has access to your clinic, they will see that as being seen and they'll know that that this patient's already being seen and they can just pick up the one that's there to see them. There's options as well here if you had a workflow where you'd like your reception team or admin to talk to a patient before you join them, they can certainly do that. They can start the call, share intake paperwork, or ask the patient to share a referral or those sorts of things. Pop them back in the waiting area and then the clinician can pick them up. And that can be done at the end of the call. You can have multiple clinicians maybe seeing one patient, like whatever the workflow would be most suitable for you, then you can certainly do that. So I'm going to join this call now. I'm just going to stop sharing the waiting area because it will open up in a new window. And once I've got that established, I'll start sharing the screen again. You'll see from the platform here, we try and keep it as simple as we can. Everything that is an action is a green button. So I'll go back to new video call after we've done the demo. But what we would want to do here is join the call. So I'll stop sharing. I'll join the call and stop sharing. And I'll start sharing again. Just thinking about that. Are you able to see that yet or no?
Not yet, Jodi.
Okay, it's just thinking about it. Sorry. Oh, let me hang up and start again. Apologies. Okay, this one. Okay. It really doesn't love it when we've got audio being shared in a Team or Zoom. Okay. So what you can see now is me and me. So this one here is me as the patient. I've come in on my mobile and I'm just going to pop that down. So my ceiling now is the patient and this is you as the clinician here. Can everyone see my screen now?
Yes.
Okay, apologies for the delay. So if you wanted to, you can just do a straight talking video call. You can minimize your own video if you really wanted to have most of your screen maximized so that you can just see the client. Really depends, full screen if you wanted to, or you can have, half and half. The more people you have in, the tiles will just filter down that you fit everybody in with equal real estate. So you may choose then that, you might want to minimize some people depending on, who you're trying to be looking at most there. So you can see there's a range of options along the bottom. Muting audio, which I've done so that I can use the Zoom audio. You can disable video. You can have participants raising hands. I think one of the things that I'll point out, you can go into the settings here and change your camera if you wanted to use a different one. You can have blurred backgrounds if you wanted to select backgrounds. We've got different levels of blur and then some simple backgrounds as well. The next feature to be released in this background would be custom backgrounds that you can choose to add in that reflect your clinic if you wanted to. As I mentioned, we can set your clinic, we call them clinics. If you're in a low bandwidth area, we can configure your whole clinic to require less. But what you can also do if you're in a video call with someone, at the moment, we've got some pretty stable internet and you can see here, excellent connectivity. In each call, if you are struggling a little bit with audio or video, you can actually open up either of these little tabs here and maximize, or change things around just to make sure that you're getting the best out of it. I won't go in huge amounts of detail about that. But certainly if it was something that you wanted to discuss with us further, those are all options, both for the clinic for all time or in particular calls. And you may find that in a multi-party call, if you've got one person that's struggling a little bit with their internet, fixing those settings for the call will actually bring everything back a lot nicer. So we have a chat box here. You shouldn't need to chat too often because you're in a video call talking together. But some people use the chat if they wanted to write a medication name or some instructions or something like that. Certainly, I'll show you where you can share documents and stuff like that. But if it was just a little quick thing that you wanted the patient to see or that they wanted you to see, you can add those into the chat there. And you can also download the chat, certainly. on both sides. Everything can be shared both ways if that's what you choose, and downloaded by both parties. Some people will use the chat if they've got someone in the call that's a little hard of hearing, but we also do have a captioning tool that we've developed as well. It's not going to work at the moment because I'm using the Zoom speaker, so it's not hearing me. But what would happen here is that the call gets captioned, and those are downloadable as well. So you could put that on for the whole call, or you might just put that on if there was a little bit of something that you were going to say that you wanted to save and share, or something that the client was saying that you might want to download into clinical notes or something like that. So there's a caption option available there as well. The call manager here just shows you what's going on in the call. I think one of the main things of interest here is if you're in a call with somebody, as we are here, and we decide that we need to call in a family member, or we've got a specialist that we said, we're going to start the call, we're going to invite you in when we're ready for you. You can invite a participant directly into your video call. So rather than them needing to have the link to come in via the waiting area, you can invite them directly into the call here. And again, you can send them an SMS, or you can email them. When they get that link, they click on that, and as soon as they activate the link, they'll pop straight into your call here. So that can be certainly used in all different sorts of situations without thinking, oh, now I've got to go back to the waiting area. Because as you can see, we've opened up in a new window here, and that just lets you do everything from within the call. If we had more than a couple of participants in here, you can also go in here, and if you've finished speaking with someone but you want to stay in the call with others, you can disconnect people from here. You can put people on hold here if need be. But probably the biggest thing that gets used for is definitely the adding additional participants directly into the call. Now we have apps and tools. So here you can decide that your patients or clients can only view things that you share with them, and can't share anything or interact with anything that you're sharing. Some people prefer to have it that way. You can completely hide the fact that there's even app options from the people that you've invited in if you want. But it does make a richer video call if everything can be interacted with on both sides. So the kind of things that you can do here is share an image or PDF, which I will try and find one. I'm on a different computer at the moment, so I just want to find something that won't bother anybody. Okay, it's a completely clean computer with not much on it. Bear with me, please. Okay, you'll see here a transcript, which is actually the only thing that I have to share. So once you share the document, everybody in the call has options that they could click on the pen. You can get digital signatures on things if you want. You could draw or highlight on here if you wanted to, or you could ask, if you were using it for therapy or something, you might share a sheet and you might ask your client, to circle things or point to things. You can do that on both sides. And you can also both download that at any time. So that can be done with document sharing. And then once you finish with one, you can remove it completely, or you can minimize it and keep it in the drawer, but we'll remove them because we're going to be going through quite a lot. You can add in a whiteboard. Same thing there. Everybody can draw on there. They can pop their emojis on there. They can do whatever. Usually, this would be something that's used really well with children for therapy and stuff like that. So you can have the whiteboard and downloadable again. And then let's see what else you might like to have a look at. You can share additional cameras if you had other cameras. So some therapies may have cameras that they want to add in there, or certainly document cameras and stuff like that. We have a YouTube player that you can play YouTube videos without competing for the audio or video. They play seamlessly in there. And I'll assume that we might have some GPs in the call tonight. We've also recently built a bulk billing consent that can be shared straight into your video. So if you want to get bulk billing consent so that you can comply with the most recent legislations around that, you can pop up this form and then you put your clinic name in here. You can decide, you can configure this. You can decide, what are your most used MBS items. You can click on the one that you want and then send it to the patient. And then on my phone, I'll consent to this, and then you'll get a little message here that the patient's consented and an email confirmation's been generated. You get to decide as a clinic where those go so that you've got a copy of that on file, and you can obtain the bulk billing consent if you do any of that for telehealth here. So that's the bulk billing consent. And some of the other apps and tools we have there are, you can change the grid views so that you can have, you can be sharing 2 or 3 resources at a time. The other thing that we do a lot of work with that we're happy to discuss, a lot of it is in state public health, but we have a lot of integrations with physiological monitoring devices that you can also bring into your video calls, so you can have real-time patient monitoring and stuff like that. It may come in handy if you're doing any work with residential aged care homes that have a telehealth cart there. Certainly a lot of them do, and then you could be getting the vitals of whatever their carts can actually do. So those are some of the apps and tools that we have. And that's basically a video call there. So when the call's finished, you've got an option here to hang up. Now, what you can do here is leave the call yourself, which will leave your patient or client open that somebody else can join the call with them, or you can just end the call for everyone, which I will do. And I'll stop sharing, and then I'll come back and reshare the presentation. Okay, so that's the demo of video call in a nutshell. I'm trying to not be too overwhelming with it. So if you're interested in having a Healthdirect video call account so you can do telehealth at your health service, you can get in touch with the PHN, or you can register online. We have an online registration, or please at any time feel free to contact us with any questions that you might have. So you can email us, and we also have a phone support line, which is admin support for workflows, training requests and stuff like that. We also have a tech team available that can help with any technical issues that you might be having. So that's, yeah, if you're interested in an account, like certainly get in touch. And the PHN can also help you. If you have a video call account, as I mentioned, we have a support team here. The setup is, it's quick, it's easy, it's flexible. Literally from you saying, I'd like a video call account, if you contact us directly, it's minutes to set up. And we can work with you to make sure that it fits in exactly with what you want. We can do quick little phone calls with the clinic administrator. We can do training for your whole clinic or for your doctors or your end users. We run webinars, we have training videos, and we can tailor the training, for really what you want. But I do like to mention as well that you can use video call immediately with no training, really. We give you the very basics that you need to get started. And I don't like people to think that it requires a lot of training. It actually really doesn't. We also have a resource centre, which is a library covering all aspects of our platform, every single thing and more than you'd ever want to know. And we also have a lot of general telehealth use cases and workflows, news stories, and that kind of stuff there that everybody that has an account with us would have access to the resource centre. And this is just what it looks like, really. We have a primary health portal, which would be the kind of stuff for any of the clinics in the Commonwealth program. And it just gives you, how to get started with us, how to get started with your clinic, the training that we have. You might not want to have personalized training. You might like to use from the video packs that we've already made. And then, definitely how to use the platform. And that's the end of my presentation. So I'll stop sharing here and come back into the meeting. Okay.
Thank you so much, Jodi. We've
All
got
right.
a fair bit of time for questions. So just a reminder for everyone, the Q&A function at the bottom of the screen is where you can post any questions for Jodi.
Nothing yet. Maybe I covered everything.
It seems so, Jodi. I actually have a question for you.
Yeah,
I'm
sure.
just wondering if there's an option in the video call platform to share your screen like you would in a Zoom or a Teams meeting, or do
Yeah,
they mostly use like the chat
you
function for that?
can. No, you can certainly share a screen. Why I didn't was already it's really hard in Zoom or Teams. So you could see, it makes a funny echo and then you go through this loop of, yeah, but you can certainly share a screen. So you can share a screen, one screen, full screen. And that's why we also have the YouTube player on there, because some people like to share a screen to show the video, but then you can get that kind of weird thing. But yeah, so you can certainly share a screen and you can share documents. So that could be like the clinician might share a referral or the client might be sharing a referral. You can send information about medications or physio exercises and stuff like that. So documents, certainly, images, PDFs, then you've got the whiteboard. Yeah, but yeah, this computer is sort of clean of documents, so I didn't have anything to really show how that works. And it does get used quite a lot, particularly, I think I said, children doing therapy. Quite often the therapist would pop up, a picture or something, or words for speech therapy. And they can be really interactive there. But yeah, certainly YouTube's documents, anything you want. And it's, the more you've got access to as well. So if you do have access to, if your clinic's got like a ceiling mounted or wall mounted camera that moves around, you can request that to be the camera. You can zoom in. If you've got those little glasses for a specialist to see what you see, like, you can add those in. So whatever extra peripherals you might have can also be shared in.
Awesome, thank you. I also just had one more question about the sharing documents
Mm-hmm.
in the call. So it was my understanding that when the call ends, like the history of the chat will be
Yeah.
wiped.
Yeah.
So do you have to save the documents while you're in the call, or you just have to open them?
You need to download them if you want to keep them. A lot of things that get shared, really nobody wants after the call, maybe. So the options are, I was shutting them as we went through. You can either download them while you're using them and then get rid of them, or you can just move on, and then at the end, everything that you've shared will sit in that apps and tools, and you can download the whole lot. That's, one of the really important things. We've been chosen by the Commonwealth and state health departments because of our privacy, so they choose to fund us. What that does mean, though, is we're not allowed to store anything. So once a call's over, that stuff does get purged. But just before you hang up, and I should have probably pointed it out, there's a little thing saying, download anything you need now, because it will be gone. Yeah.
Thank you. I'll give just another minute. If anybody has any last minute questions, feel free to pop them in that Q&A box. But while anyone's entering their last minute questions, I'd just like to say a really big thank you to you, Jodi, for joining us tonight and for such an excellent presentation. We do have another digital health webinar which is planned for 7 p.m. on Wednesday, the 24th of July, for those who've joined in this evening. And the focus of that webinar is going to be on optimizing e-referrals, so smart forms. So please save the date for that one, because we have a few speakers joining us on the evening. Your evaluation surveys for tonight's webinar will be sent out very shortly. So please make sure you fill those ones in so that we can email you your certificate of attendance for this evening, and make sure that you still remember to self-report CPD hours in your CPD home for attending tonight. Presentation slides and YouTube recordings will also be emailed to participants who complete the post-event evaluation. So please make sure you jump on and do that. And if we don't have any other questions for this evening, then that's all for tonight. Thank you so much, Jodi.
And please feel free to get in touch with our team if you think of something later, or if you're interested in getting started with video call. And thanks for having me, Michaela.
Thank you. Our pleasure. Good night, everybody.
Thanks. Bye.